Welcome to Toni Unleashed, the podcast where we unleash the truth about all things pets.
Our research and anecdotal evidence matched with pet expert interviews will help you help your pet thrive.
We are here to answer questions, divulge information, and spread awareness about what's really going on in the world of pets.
I am your co-host, Emily Taylor, pet nutrition enthusiast.
And I'm Toni Shalasky, owner of Healthy Pet Products with 3 locations in the Pittsburgh, Pennsylvania area, and recently expanded to Port Charlotte, Florida. Welcome to the show. Hello, and welcome back to another episode of Toni Unleashed, the podcast. We are welcoming back one of our very favorite guests, Rebecca Rose, the owner and founder of Inclover. For those of you who don't already know Rebecca, or Inclover Research, here is a brief background about the company. Inclover Research develops the only animal wellness supplements scientifically designed for pets' unique physiology, supporting better health from the inside out. Rebecca Rose, who has dedicated her life to the study of how nutrition supports overall health. A pioneer in clinical research, she is the author of 3 patents, and her published works continue to inspire scientists and developers around the world. Under her leadership, Inclover set the gold standard for animal studies, utilizing state-of-the-art technology, sound scientific methods, and humane practices. As Inclover's product developer, she carefully formulates innovative supplements using evidence-based research and the finest natural ingredients. This unique, hands-on approach ensures your pet receives therapeutic levels of active ingredients for results in a single container's use. I've been carrying Rebecca's products for many years. Honestly, I think it's got to be 14 by now. And I feel so comfortable recommending these products. I know they're safe, I know they are a clean product, and I know that they have been tested and proven not only anecdotally, but also clinically. For those of you who are just tuning in, check out some of our earlier episodes with Rebecca. Our dental episode and our digestive episode, we're going to get you those actual episode numbers. They feature Rebecca as well. And she elaborates on dental health and digestive health. Welcome, Rebecca.
Hello. Good to be here again.
Yes, it's been a while. It's so nice to have you back on the show. This is a topic that I personally don't know enough about, so I'm really excited to learn more from you today. And I hope everyone who's listening gets to learn just as much as well. And yeah, I always learn so much every time we record together. Yeah. I mean, even about topics that I thought we knew about, we're like, didn't know anything about that.
So true.
This is really exciting. I mean, we get so many questions all the time
about kidney
and about bladder. And it is a tricky to navigate with customers, tricky to navigate because we're not veterinarians. So, I'm really excited to learn more about the product that you have created to help these customers and why, what's in it, just everything about it. So let's get into it.
Yeah, I love talking about kidney health because it's a topic that isn't talked about much at all, although it's a huge issue. Mm-hmm. So 1 in 10 dogs are affected by kidney problems, and it's the number one reason why insurance companies are telling us that people are taking their cats to the vet. So It's something that's on people's minds, but it isn't something that gets addressed in a more holistic way. And the way I came into kidney health and developing this product, BioRen, that we're going to talk about, is that I was contacted by one of our retail partners, and they said, we need you to come up with a product for kidney health. It's something that our store folks get asked about, and they don't have a really good answer for it. And I said, I don't know, tell me more about what you're looking for, because I know the standards kind of with, what people do if they have animals with kidney problems, but I didn't know of a whole lot of products that were out there to supplement and help the issue. Mm-hmm. And so what they said was, you need to come up with a product that addresses 6 issues. 1, you have to get rid of the bacteria. You have to get rid of the inflammation. You have to have something that helps to develop the muscles. And I'll explain a little bit more why that's important. You have to address the supersaturation, and that means you have to make conditions unfavorable for kidney stones and crystals. Then you have to add back essential amino acids and water-soluble vitamins, because we know that animals with kidney problems urinate a lot, so you need to add things back. And then you need to detoxify the system. So that's 6 things that they had asked for. And I said, thank you, I'm flattered, but no, I don't really want to take this on. And they continued to just really communicate what a big problem this is.
Yeah.
And I said, I'll look into it. Let me look into it. But it seems like it's a big problem. And I will tell you that this product, BioRen, is the most difficult product I have ever developed.
Wow.
Because putting something together that addresses those 6 issues, while it's 100% natural, 100% active, can be used in a healthy animal to help to prevent and keep a healthy system, and can also be used in an animal who's actually seeing problems and is probably on a prescription diet. It had to follow that whole spectrum. It was really tough. And so BioRen has ticked all of those boxes, and we've seen some great results with it in the field and with animals as well, and working with vets. So we're pretty proud of that.
Awesome.
Wow. So you're working with vets on what this product, and what is their feedback, and what is their approach, and how do you even get to the place to you can work with vets on this and have them recommend it?
Yeah. So the way we're working with vets is with nephrologists, so veterinarians who are specialists in renal health. And what we are doing, we're starting our work with cats, and so we're working with animals to show how with BioRen, if you go into a situation where an animal has, and in this case a cat, has chronic kidney disease and it's at a level 2 or a 3, we can bring it back down so that it is back to a level 1 or a level 2. And so we're doing some work with the animals and doing some laboratory tests, urinalysis and blood work with them.
Wow.
And so far we have seen good results. We're early into this research. We've done some work with cats and dogs as we developed the product, but we wanted to work with more specialists, veterinarians who they see this day in and day out, and they really understand what the early indicators are, because ultimately that's our goal. We want to hit those early indicators and head off these kidney problems.
So a cat or a dog that has actual kidney, I guess,
Elevated kidney levels.
yeah,
We'll say that.
yeah, they can come in and use this product, and most likely they will see improvement.
Right. We've seen some really good results in those cases.
Wow.
And that's if you think to those 6 modes of action for this product, that's what we're really trying to do, is to address those issues and to try to bring back a healthier renal system overall.
So, Rebecca, how long do you recommend a customer keep their dog or cat on the product before follow-up blood work to see if it's working? Like, what do you think about that?
We're working on cadence right now, but what we're looking at right now is a 3-month increment.
Okay.
So start on the product, test in 3 months. Some folks have tested earlier, and we have seen some good results, but our numbers are still, a number of animals that we've looked at is still relatively low, and we want to get, it's not a controlled population because we're working with actual veterinarians and patient clients. And so it's not like, we've given these animals kidney problems and then we've tested for it. So we're working with a pretty wide population of animals who are in some stage of kidney issue.
And I'm sure you're recording all of this data. So For our listeners, can you maybe explain a little bit, like, because a lot of supplements will say veterinary tested or veterinary approved. Like, can you tell our listeners what exactly that means and who is allowed to put that on there and who isn't?
Yeah. Unfortunately, anyone can put it on.
Yeah.
There.
Yeah.
So if you have
That's kind of where I was going.
Next door neighbor who's a vet, and you're at a barbecue and they like you, and you can say, do you approve of this? It's good to put on there. You can do it in any way. And so that's the difficulty with this. But I mean, it doesn't really, it's neither here nor there.
Sure.
What we like to do is we like to work with experts in the field. And so when we worked with our BioVibrant, which is our heart health, we worked with a veterinary cardiologist. And as we're working with the kidney health, we work with specialists, nephrologists in that area. And we take a statistically significant number of animals who have an issue, in this case, kidney issue, and we start them on. So we've measured, we've done the lab results. So we measured, we know where they are. We know what the baseline is. We start them on the BioRen, and then we measure that baseline to see where we are getting improvement. And we then look at time stamps. So we look at how long did it take to see that improvement. And even with that, we've stayed away from veterinary tested or veterinary approved on our packaging just because it doesn't mean anything. But we've been very careful about, we have white papers, we have a lot of really good educational information. And then we work with folks like Healthy Pets who are educated and can then talk to customers. And that way you feel confident when you're recommending the product. And it's not just me saying, oh, try it, it works, really.
Do you notice a difference in these levels? If a cat, sorry, let me rephrase. I guess from our perspective, we kind of expect a customer who comes in and said their cat is only on kibble and has only ever eaten kibble and will only be on kibble to most likely have bladder kidney issues long term. Can you take a cat like that who's been on kibble for their entire lives and has kidney issues? Can they stay on the same kibble, be given this supplement, and see improvement in the levels if they have, an issue? Because we usually recommend moisture and clean diet to help prevent these sort of issues.
Right. And that's what we're working to prove, because quite frankly, most people are feeding kibble. And so we know that is the case. And with cats, sometimes it's trickier to get away from kibble than it is with dogs. And so what we're looking at are populations of cats who are kibble feeders, not like with my cats, they're raw feeders. And, still with my male cat, he has been prone to having stone formation. And so I think, it's a very common issue, and especially in male cats, it's a problem. Regardless of what you feed, it can still pop up. And so our goal with BioRen is to have the cats and dogs start taking it, especially these kibble feeders, start taking it early on and provide them with the nutrients that will make conditions very unfavorable for stone and crystal formation, clear the bacteria out of the system. We add, for example, mannose that doesn't allow the bacteria to adhere to the lining of the renal system. So we set it up to be like squeaky clean and all the best situation so that it stays a healthy system.
So that being said, you recommend it as prevention and a treatment.
Yeah, I was going to say the same thing.
Yeah, and so on the treatment side of things, we recognize that a lot of folks, when they go in and they get their levels tested and they find out that, okay, you're borderline or you're at some level of chronic kidney disease, then the first thing they're going to do is go to a prescription diet. I mean, that will be the recommendation. And in this room, we know that prescription diets were developed for temporary use, not for long-term use. And so what has happened is that people start on prescription diets and they continue with those prescription diets.
Yes.
And because the protein source is not made for an ongoing source of protein, what happens is they get muscle atrophy and you have other problems. And so what we've done with BioRen is we've added
the bladder is a muscle.
Pardon me?
Isn't the bladder like is a muscle?
Yeah.
Wow.
Yeah. And so we've added L-carnitine to help build that muscle back so that we can recommend this if they are already down that path and maybe they want to stay on a prescription diet because that's what they're comfortable with. Supplement that because you'll want to counteract some of the issues around the prescription diet. And my stance is that for things like renal health, supplementation is the way to go. It's a condition that's made for supplementation. It's not something that you want to put them on a very good diet and supplement. The prescription diets, personally, I feel like that's just not the answer.
Yeah. With that being said, with your extensive research and being so heavily involved with veterinarians and kidney bladder health, can you talk about maybe some of the symptoms that pet owners can look for that may lead to, maybe getting those levels tested or maybe that there's a problem?
One of the most common ways people know to get tested is frequent and excessive urination. So you're going to see them just urinating so much. And sometimes it can be going into the, for example, for cats, it can be going into the litter box and straining with urination, or it can be continually wanting to go out and go to the bathroom. When you see that, take note, because if they're straining to urinate or if they're going through frequent urination and painful urination, that's a big clue that you've got something going on. And if you can catch it early, so much better, because what's happening is that they're urinating so much that they're getting rid of the essential amino acids and the water-soluble vitamins, and that's going to create other problems down the road. And you're also going to see some problems with blood pressure, and that impacts the kidney health. And so all of these things are little clues that you can look for to then say, I just want to get it checked out and see. And over and over again, everybody has a pretty good idea of how often their cats and dogs urinate. Yeah. And that's where we catch it first.
Mm-hmm. I know my male cat had a UTI, and we noticed it because not only was he peeing more frequently, but like in really random places outside of his litter box. So if I was putting laundry away, like laundry baskets were a big one, or in the closet, or, in houseplants. And we're like, this is unusual behavior. Let's get this looked at. Yeah.
Yeah. And that's a great point, because if it's unusual behavior,
right,
they're probably not doing it just to irritate you. They're probably doing it because something needs to be looked at.
Well, and knock on wood, I'm going to say I've never had a dog with any renal issue, urinary tract infection issue.
So I have, and those medications are very expensive.
Yeah.
I was very surprised because I am the pet owner that goes to the vet often for check-ins, anything strange. I immediately go because I have a really great relationship with my vet. I feel very comfortable going.
And I never go.
Yeah. I mean, sometimes we just go to check in and, whatever. But I did. And so with that being said, I don't have very high vet bills because I go so often and they're little small vet bills here and there. And I went to take a urine sample because I knew something was wrong. And the medication that they prescribed me was higher. The cost of it was more than like 3 vet bills combined.
Wow.
It was very expensive. And I was like...
And it was just an antibiotic or, yeah?
Yep.
Yeah.
Yep.
Well, so Rebecca, shall we go through each ingredient and explain the benefits of each? Do you want to do that?
Yeah, let's do that because I think that's a good way to show it's not rocket science. We add ingredients with a purpose. Everything is 100% active, so we're not adding anything that doesn't need to be there. So if we go through our ingredient deck, we have one of the ingredients that we've added, which I really love, is a postbiotic. So what a postbiotic is it's a special strain of yeast that we very gently take enzymes and we break it open and we release all of the nutrients that are inside. And that's where there are a lot of essential amino acids, a lot of the B vitamins. That's what are the main water soluble vitamins. And things like beta glucans that address the immune system and inflammation. Just a powerhouse ingredient. And so that's one of the ingredients that we add. And we added it when we looked at it, we tested the levels of water soluble vitamins because that was the primary reason we wanted to add it in. But we found that it had a lot of other good uses as well. So powerhouse nutrient is that yeast that has been broken apart with enzymes. The next big category is the anti-inflammatories. So when we have issues in the renal system, the first thing that we want to do is get that inflammation down. And you'll notice in a lot of our products, that's kind of the next level, is that we get the inflammation down so that we can get to the affected site. So we use 2 ingredients for the anti-inflammatories. One is yucca, which is my favorite anti-inflammatory. And then the second is omega-3 fatty acids. So combination of those 2. Then we want to work on the bactericidal. So we want to get those bad bacteria that are over flourishing in the renal system. We want to get those under control. So with those, we add the mannose is actually stopping them from adhering to the walls. And then we're adding the ginger and we're adding dandelion leaf to help get everything flushed out of the system, and green tea to kill those bacteria.
Wow.
So that combines the detox with the bactericidal and then not letting anything adhere so that we can then flush it out. Second to last area is the supersaturation. And that's what the prescription diets work to do, so supersaturation tells you how diluted or concentrated the urine is.
Mm-hmm.
And so we use resveratrol, and that's our, that helps to get the concentration in the urine so that kidney stones and crystals aren't able to condense and form in the renal system. So that's a pretty important ingredient, the resveratrol. The last thing that we did, the 6th mode of action is the muscle development. And I had mentioned that we add L-carnitine to this as a way to help with keeping the muscles healthy in the system. because that is something, especially with prescription diets, that you're going to see. And that's what the pet parent will notice, is that, wow, they just don't look as robust. It looks like they're really getting, their muscles are really degrading.
I've seen it.
Interesting story. We have just started to notice that some of the prescription diets are starting to add L-carnitine to the prescription diet.
Interesting.
So I don't think it's a secret that these things are happening. I think it's a known issue.
But I wonder if they're adding enough.
I don't know. And that's part of why I think supplementation is better than trying to put something like this into a prescription plan.
We say that all the time.
I think it's important to note here that all of the everything that you listed and talked about that is in this supplement is really beneficial overall for the body and for the dog. And that does not come with side effects or that you have to make up for it, like we so often hear with medication or prescription diets or.
And a lot of these pets are seniors. So, I mean, even the resveratrol is good for cognitive function, right, Rebecca?
Yeah, resveratrol has an awful lot of good attributes.
Yeah.
Aside from the supersaturation, it is a powerful nutrient. And I'm really glad you brought that up, because if you think about it, if you're giving your pet BioRen, and let's say you're doing it more as a preventive, you're going to have the benefits of supporting the normal inflammatory response, keeping the muscles healthy and developed, and the weight ideal, essential amino acids and water-soluble vitamins, and detoxing the system.
Yeah.
And those are all things that are really a nice thing to give to your pet.
So when you said resveratrol and stones, so we do have a lot of kidney stone customers. So do you think it's safe to say that we can recommend this for dogs that have recurring kidney stones?
I do. It's going to fortify the renal system overall. It's going to get the concentration right so that it's unfavorable for kidney stones. I've been looking for years of how I can get resveratrol into one of my products. It is, and I think this is the perfect product because it really does focus on benefit in the kidney system. And now you'll hear about it, like it does everything, anti-diabetic and everything, but the research is really focused on the renal system.
That's awesome.
Wow. You just talking about all of this makes me just want to put my dogs on this as preventative care and to help strengthen their bladder to help prevent this from ever happening.
Yeah, and I give it to both of my dogs also, who don't have any indication of having kidney problems, but like we talked about, it has so many good nutrients in it that I feel really good about adding it. I like especially that it detoxifies the system. And I think the two things that are always beneficial is the anti-inflammatory and the detox.
Yeah.
Okay, so that brought another ailment to my mind. Since we have an ingredient in here that helps build the bladder muscle and maintain the bladder muscle, do you think that we could also recommend it for early incontinence?
Yeah, I really like that. I like the every now and then we'll get an anecdotal story about connectin helping with early incontinence or bad incontinence.
Really?
And it's the glucosamine.
Really?
Is what is helping with that. And I think sometimes with incontinence, it's hard to pin down exactly where the problem is. But I think this is one of those things where absolutely you can certainly try it with that. The nice thing about BioRen, it's 100% active. So you'll see results very quickly. If you don't see results and you don't want to continue on it, no harm, no foul. You can move on and try something else. But in that time, you will have given your dog or cat more nutrients and more of the actives that their body needs than any pet food would be able to give.
So I'm going to have my brother and his wife put their dog on BioRen for Panda's incontinence.
There we go.
She was an early spay because she's a rescue dog. And she's only 4, and she will full bladder release in the middle of the night. Yeah. I got them those pet parents and the tall tales blankets. They have been using, which we can't get anymore, Dr. Jody's Pea Support. Is it called Pea Support?
Pea Support, yeah.
It's porcine bladder.
Yeah.
Freeze-dried porcine bladder. And they were having great success with it. But I reached out to her, and I don't think she can find the raw product anymore. So she sent me one of their last jars, which is pretty big, and they're like rationing it. But I'll have them start the kidney health and see what happens, and if I'll definitely let you know. And, like you said, it's still giving her beneficial ingredients in many ways. And we could also start incorporating connected.
Yeah.
She's an active dog. She's 4 now, so
doesn't hurt.
But I'll start with kidney health first, so we know, and maybe get some anecdotal feedback from them.
Emily Claire, are you just wanting her to just like push everything at it all at once and not go one at a time?
No.
She knows you so well. She knows you so well.
So, plot twist, I'm working on my anxiety, my stress.
She's been working so hard, Rebecca. We are so proud of her.
I have a therapist.
Nicely done.
But that's what's so great about your products, though, is that, they have so many so many things that target one thing, because it is hard to be like, oh, dandelion could be really good. Glucosamine could be really good for this. An anti-inflammatory could be really good for this. Boosting the immune system could be really good for this. But your products kind of all cover that with one supplement, like we just talked about.
Yeah, and we do spend a lot of our resources on the development side, and so that we can have a very thoughtful solution for folks. And that's why we don't come out with things very often, is that it takes a long time to come up with something that not only addresses those 6 major modes of action that we discussed, but also is going to be 100% natural, is going to be 100% active. So we're not adding anything just because it's all for a certain purpose. And we have to make sure that we can get it inside the animal. So it has to also, you have to be able to give it easily. So we use our active ingredients that will also offer a good flavor for the animals. And that's where our, with this, for the cats especially, the postbiotic, this special yeast that we broke apart, all those things taste really good for a cat.
So what are your thoughts on cranberry then? There's so many supplements for bladder, kidney that are just cranberry.
Yeah. So we didn't add cranberry because cranberry is so the active component. So cranberry is added a lot of times for pH adjustment, which makes sense. But there are 2 types of stones, and so you have to be careful with pH adjustment if you're working to make conditions unfavorable for stones.
Mm-hmm.
And so what we've done is the active ingredient of cranberry that stops the bacteria from adhering is the mannose. So in natural cranberries, they have the ingredient mannose, and that's what stops the bacteria from sticking. And I think even more than pH, that's important. That's the most important, is that we've got to clear that system, clean it out, get those bacterial levels down. So instead of adding cranberry, which can tinker with the pH in ways we might not want, we've added the mannose to take the good things that cranberry does and really concentrate it at the site.
I think that's really great information, because I think people know that cranberry is directly is a great source for helping with UTIs and urinary tract infections, but don't really know why.
Yeah.
I mean, cranberry is everyone's go-to, but
Right.
Right. Why?
Yeah.
Now we know.
Okay. So Rebecca, did we miss anything about BioRen?
You guys are so thorough.
Oh, it's all M. She
No,
writes
you're
them.
thorough, Rebecca. You're thorough. Oh, I do have one question we did miss. How after someone starts using BioRen on their pet, how soon will they see it to start working, and will they start noticing less frequent urination and it start kicking in?
And we have a pretty wide range of what people are telling us and what we've seen in the results. And so what we've looked at is, are we seeing results within one container's use for a 50-pound dog? And absolutely, yes, we are. So that would be like 42 days for a 50-pound dog. We're seeing results. And I kind of like to set expectations there that you're going to have to use a container, and you are going to see a difference. And because with kidney health, it's when you see a difference, it impacts you in a really big way, because think about your brother.
Yeah.
Bad.
Yeah.
And so we're getting reports of some earlier, but I'm gonna stick with you're gonna need to use a container and then make your assessment. And you should see the results. It shouldn't just be, I don't know, I think they look better. You should see a difference.
So a container recommended dosage is good for 42 days for a 50-pound dog. Is that what you said?
Correct.
Okay.
I love that, because I think that also, I'm glad that we ended on this, because we talked about how incredible this product is, but also people are so used to being prescribed a pill and having it work immediately. And to be able to help really heal the body from the inside, it takes more than a couple of days to do that in a really healthy, effective manner.
Yeah.
And so we are looking at 42, 45 days to really solve a problem here.
Minimum.
Yeah.
Minimum.
Yeah, and I think that's really important to know.
Yeah, and go back to those. I keep going back to the 6 modes of action. And you didn't get muscle atrophy, inflammation, built up bacteria overnight. You know, that's something that is happening over time. So Emily Claire, your way of staying ahead of animal health care is really smart, because supplements should be used, and animal health care should be used it should be simple. It should be something that is used in advance of something going off the rails. And you should be able to keep that well-tuned system through old age.
Yeah. Just imagine how different our world would be if we put more money into preventative care.
No. Don't get me started. Yeah. Okay. Rebecca, how do people find out more about Inclover? Tell us your website, your Instagram, all that kind of fun stuff.
So you can go to inclover.com. You can go to Inclover Pet. Those are our social handles. And there'll be links also on our website to Instagram, to Facebook. We don't do much with TikTok, but there are a couple of videos up there if you want to watch. Oh, and right now, the most fun thing that we have is that I have a silicone like ice cube tray with little paw prints where the ice cubes would be, or paw print shaped ice cubes, I guess. And what I do is I've tested it both ways. I use water or bone broth, and then I mix the supplements into that for the dogs, and it makes a nice summer supsicle for my
Supsicle. You have to trademark that right now. Talk to your attorney. Done. Trademark supsicle.
That's also such an easy way to add all of your supplements to the bowl without taking the time to unless you go with my idea that I have thrown out a couple of times where we have that sprinkle container that has 7 different sprinkle options in one container, and you just have to pop the lid open and dump it in. But of all of Rebecca's supplements.
Wow. Wow. I don't remember you saying that before.
Oh, I think about it all the time. Every time I see Rebecca, I'm like, I just need a sprinkle container of your supplements, because every time we talk, I'm like, I need that. I need that. I need that.
I have so much powder in my dog's food that I have to add bone broth or milk, goat's milk, and then I stir that part up so it's kind of mixed. Oh my goodness. It's a whole thing.
Popsicles.
Yeah.
Yes.
Yeah. It takes me 10 minutes to do an entire month's worth. I've got this big tray and I just make all of them, and
one a day.
It's kind of fun.
Mm-hmm. Yeah. That's cool. I like it. I like it a lot. Well, thank you as always for being on. We love you, and
we'll see you next week.
Yeah.
Sounds good.
Okay. Talk soon.
Talk soon. Bye.
Bye-bye. We want to give a big shout out to our sound engineer, Brad, from Beacon Sound Systems, LLC. This is the highest quality sound editing, and he knows exactly what to edit. So it's his fault the F-bombs are still in there. You can reach Brad for all your sound editing needs through
Instagram and Facebook. You'll follow at Beacon Sound Systems. Website, www.4beaconsound.com. Phone number, 724-471-2410.
Beacon Sound is a locally owned company in our neck of the woods here in Pittsburgh, PA. So if you're in need of large LED screens, stages, lighting, or sound systems for any occasion, big or small, this is the company for you.
Sounds like a party in one.
And boy, do we need one.